I'm Janice Key. I am a pediatrician at the Medical University. I've been a member of Charleston County Medical Society, I think, since I moved to Charleston in 1991. And I was invited to join by some other physicians in town that I really admired their community work, and they invited me to join them in that. The thing that motivated me to join the Charleston County Medical Society was the opportunity to work on the school health committee that's been meeting loyally every month since the 50s, and it is an advisory committee of physicians from Charleston County Medical Society. Not all pediatricians, all kinds of physicians, cardiologists, ophthalmologists, and a lot of leadership staff from the schools. And we meet every month to discuss health issues that are occurring in the schools, but we try to use our health knowledge to advise the school district. And because of that long-term relationship, I have to say our school district probably has the best, most comprehensive health approach of any school district I know of. Over the years, we've done things like find the funding to have more school nurses. We helped with behavior problems and too many kids being suspended. We've helped with getting kids immunized if they were delayed in their immunizations. We've helped with finding medical homes for kids that are students at Charleston, in the Charleston County Schools. So whatever the need is, we shift our focus onto that. The purpose of the Charleston County Medical Society is to have a common ground where physicians can be part of an organization that is not related to any particular health system or employer, but is solely focused on synergizing together to help our community. And it gives you an organization as in your profession as a physician to come together, regardless of your employer, to serve your community. This is still a small town, so it's really kind of nice to know physicians who are not in your subspecialty, but and maybe don't even work at the same healthcare system that you're in, but to just know each other as physicians in town. We partnered with experts like pediatric dermatologists on our committee and the school nurses to change the law such that kids could carry sunscreen and put sunscreen on during the school day. Believe it or not, that was classified as a medication. This whole process took about 3 years, working with other organizations in the Charleston area, but it was a simple fix. Once we made a resolution to the South Carolina Medical Association, their lobbyist helped us with speaking to the legislature, and they made a change such that sunscreen is no longer treated like a prescription medication. I would say involvement in the Charleston County Medical Society impacts the care of patients because I have a greater knowledge of resources available. Also, I just have a broader approach to knowing the health of my community. So I know about different neighborhoods and what are the resources in the different neighborhoods, what are the playgrounds in that neighborhood, and so forth. I'm just a better member of the community, and you know, your patient doesn't live in a bubble when you treat them. They leave your office and they go out into the community. 80% of our health is factors from the community. 20% of our health is what happens in your doctor visit. So I get to impact a little bit more of that 80%.